Hello, this is Jeannie Peroni and I am an MSIDT student at Ashford University. This is a presentation covering the updates to my project. The name of the course is Dental Radiology Training. The goal of the instruction is to train veterinary medical and surgical staff to take digital dental radiographs of the dog and cat. In this project, the target audience are adults between the ages of 18 and 65 years. The educational demographic consists of high school and college graduates. All of the participants are employed by a veterinary clinic either as an assistant, certified assistant, or credentialed veterinary technician or veterinary nurse. Certified assistants and credentialed technicians have completed schooling and licensing in their state. Assistants that have not gone through schooling are trained on their job tasks and skills by members of the staff within the clinic they are employed. Participants in the dental radiology training can vary in their knowledge of dentistry and dental radiology. Some participants either perform dental procedures or are learning to perform dental procedures. Credentialed technicians have taken classes in dentistry. Certified assistants and non-certified assistants are provided dentistry education on a need-to-know basis from either the veterinarian or an experienced staff member. The dental procedure commonly performed by staff members are charting the oral exam findings in the dental record, cleaning and polishing the teeth, taking full mouth radiographs, and assisting the doctor with oral surgical procedures. Performing an oral exam, cleaning the teeth, and taking full mouth radiographs requires training. The course is divided into two sections, an online course and a face-to-face training. The face-to-face training will provide skill building through interaction with the dental unit, course materials, and the facilitator. An agenda is distributed to the participants, which divides the training into units with activities attached to each unit. The first phase of the training is named Dental Radiology Training Part 1. This is the online portion. The online course will be completed by the participant before the face-to-face training session. This course covers prerequisite knowledge needed to begin taking dental x-rays. Topics in the online course include oral anatomy, working with the dental chart, operating dental x-ray equipment, and dental x-ray safety. The diagram shows an example of the layout of one of the units. Each unit will begin with a background knowledge probe to assess the participant's current knowledge on the topic. The participant then starts the unit exercise, such as a video or graphic. Once the exercise is completed, the participant is asked to describe the muddiest point of the unit that caused the most difficulty. After the survey is completed, the participant takes the unit quiz. The participant takes units 1 through 4 online. Once all of the units have been successfully completed, a certificate of completion will be issued as proof of completion. Part 2 introduces a face-to-face course. This is a live training. The lesson plan for the face-to-face training will have the unit objectives and the manual that will be used. Each unit will have a facilitator training script for each of the unit demonstrations. A rubric for each unit will be designed that the facilitator will use to assess the success of the participant with the learning objectives. An instructional reaction survey will be created to ask how the learning experience was for the participant. Unit 5 is a review session that will allow the participants to share any difficulties they have had with the online course. Using the Think, Pair, Share assessment technique, the participants will be divided into groups of 2 or 3 depending on the size of their groups. Unit 6 will cover the components of the diagnostic dental radiograph to prepare for troubleshooting technical and positioning errors. The diagram in Units 7 and 8 will cover how to correctly place the sensor in the oral cavity and align the tube head over the sensor. For this project, it would be beneficial to know if the training addressed the requirements of the job. This summative assessment instrument would be done at 2 levels, one at 3 months and second at 6 months after the training is complete. The survey questions are based on the performance skills that are conducted by the participant on the job site. The survey is designed to examine whether the job is being performed at a higher level than immediately after the training is complete. And that is a short update on my MSIDT project. Thank you.